Hello, everyone, and welcome to this audio podcast. This audio podcast as part of a Cortical Capacitor series or edition. This audio podcast is part of my MaxxaR Pathology, and this audio podcast as part of a Storm Robotics production. In this audio podcast, a little bit around sort of library, in around library healthcare partnerships, and also looking into um, sort of um, sort of multi in around sort of the centric aspects around multidisciplinary team meetings or MDT meetings. So for a long time, multidisciplinary team meetings or MDT meetings have traditionally taken place in secondary care secondary care or in around secondary care or primary care. However, in secondary care, in amongst particular specialties, coming together to discuss to discuss sort of the care plan for patients. These meetings have always taken place sort of in amongst the background, and whilst it would still be a challenge to perhaps have sort of a sort of patient centric MDT meetings in amongst um, in amongst sort of between healthcare sectors, this should be investigated at primary care level to increase healthcare integration and further in around electronic patient record awareness. The notion of patient-centered MDT meetings would increase knowledge and understanding of health at various stages of care, and where healthcare professionals within practice can and should physically involve sort of patients, and they involve patients to discuss a sort of healthcare aspect healthcare for healthcare to discuss aspects around healthcare. One example is one example in around this um, uh, has been has been where a sort of a program or basis aimed at increasing the activation of patients attending a clinic for people for people on low income or salaries in the United States, and the program focused on teaching patients how to draw up and prioritize questions regarding health or healthcare concerns and treatments before meetings with healthcare professionals. The program was evaluated as part of a randomized control trial, and found that the patients who were placed in the in the intervention group had a significantly increased patient activation scores. And in addition, they asked more questions during meetings with physicians, and were more likely to use decision aids specially designed information resources than those who did not receive the sort of intervention. Many patients with long-standing conditions do not see a role for themselves in managing their health, or are ineffective at doing so because they lack the skills, or, for example, again, health literacy or confidence. As patients' confidence levels increase, they gain a greater sense of control over health or healthcare and feel empowered to take action. Another important factor in around the basis of patient-centered, patient-centric and multidisciplinary team or MDT meetings at sort of primary care level, for example, is the use of strategies that stimulate and that prompt autonomy and sort of the motivation around autonomy. And there should be a sort of a call for for works to sort of prospective works to physically involve patient perspectives and encourage a shared decision making. Having access to electronic patient record alone will not help encourage patients to gain confidence and or understanding, especially if they are overwhelmed by health choices and health literacy complexities. Patient-centric Patient-centered MDT meetings, however, would allow patient and carers to gain more electronic patient records awareness and integrate a sort of tighter understanding of what sort of investigations, for example, actually mean. MDT meetings at the same time arranged could be focused at sort of dedicated time points between healthcare professional and patient or carer, and these again could take place in a sort of a library setting, which would be which would be a more inviting environment. A patient and carer would also be able to access additional resources of information to support decision making, and individual consultations may indeed take a little longer, but time spent interacting and involving patients in decisions may reduce overall time spent dealing with patients who are unsure or unhappy about a decision in which they were not involved. Shared decision making may involve a sort of a rethinking clinical pathway or design to incorporate time for information provision and care. So almost all around just over 93% of public libraries allow the use of portable drives or other storage devices, and two-thirds, around 64% support the use of digital cameras, for example, and other content options. Overall, information technology, for example, where the internet and sort of smart devices today allow accessing online library resources at any convenient location. GP surgeries or general practice surgeries and partnerships should contemplate on implementing sort of a rotation-based, patient-centric and multidisciplinary team meetings in libraries, where one general practitioner, for example, from a practice can sort of rotate and call upon colleagues from primary and secondary care between healthcare sectors to meet at library location where a patient is also called in, and this should be at least piloted for patients with long-standing conditions, since they may have a number of they may have comorbidities and may require further support around and with regard to electronic patient records, health literacy, and online support, who may otherwise not know how to utilize facility electronic sort of electronic sort of facilities. A library centered service would also allow access to broader resources and information post multidisciplinary team meetings in a public environment. That draws this audio podcast to a close. This audio podcast is part of a Cortical Capacitor additional series. This audio podcast is part of a MaxxaR Pathology. This audio podcast as part of a Storm Robotics production.